As far as the dengue cases are concerned, under Primary Health Center jurisdiction of Aldona, in the preceding months, January to July, we had only about 36 suspected cases and confirmed 7. So 7 cases from January to July. Okay, in August, there was a rise in suspected cases. So we had 20 cases in August as suspected dengue in our whole jurisdiction, and confirmed were only 2. While in September also the figure has remained same of 20 suspected, only number of confirmed has increased to 4. Now this good control has been achieved due to the constant effort of my staff under each health wellness center under the jurisdiction of PHC Aldona. They have been conducting weekly, every Saturday, anti-container drives, ward-wise, targeting those wards where they feel the containers would be maximum, and that strategy has really given us wonderful results. Just before the Ganesh festival, for 2 weeks, they did an additional anti-container drive in all the villages. They mobilized staff from even the other sub-centers and health wellness centers to help them in the drive, and we were able to destroy a number of containers throughout all the villages and wards of our jurisdiction. That is why in this last Ganesh week, we practically just had 2 cases of 2 suspected and 1 confirmed. Now with the rains that have just come in during this Ganesh week, we hope to continue these anti-container drives ward-wise in the villages, and as they were aptly supported by the sarpanches and the panch members of all the village panchayats under jurisdiction in our drive prior to Ganesh, we have also requested the sarpanches and panch members to continue the drive. We have taught them how to go about it, and to continue the drive at least for 2 weeks post Ganesh, because now once the rains recede, there will be water collection in small containers, and these have to be emptied because that is the whole mantra of dengue prevention. Because when we do fogging internally in the house and surrounding the house where the dengue mosquito sits at a lower level after it has fed, basically waiting to lay eggs. But in that small container containing little bit of water, could be a small cap, could be a small shell, or any of the discarded items, this mosquito can lay even up to 300 eggs, which will translate into at least, let us assume, half the thing, 150 mosquitoes to be on the lower side, or a full maybe even 300 mosquitoes just 7 days later. And these mosquitoes need not be infected with dengue virus, because most of the time the dengue virus is transmitted in the eggs, and these eggs once come into mosquitoes will actually carry the dengue virus and bite the human being for its survival, to lay eggs. The female mosquito does that. So the whole focus of our dengue prevention is to destroy the eggs which have been laid in the vicinity, and then we go ahead and do the fogging to kill the infected mosquito, which probably is still inside the premises of the house of the infected patient and the surrounding areas around the house. So this has been the whole focus. So I request each and every sarpanch, panch member, and through them each and every village health sanitation committee and the locals, to go around your house, not every day, just once a week is more than enough, because it takes 8 to 10 days for the eggs to come to develop into adult mosquitoes. So if they go just once a week, as we have told most of the sarpanches, try it on Sunday, once a week, every Sunday, for just 10 minutes for 3 weeks. And I'm telling you, we will probably tide over the impending crisis of dengue. Right now we have no crisis, but if we are able to take care of the eggs by destroying these containers, we will practically not have any surge or any uprise of dengue cases in our locality. Another request to the general public is, many a times we have patients coming here after 3 days, 4 days and 5 days of fever, and sometimes they do the test in private and they come NS1 positive. A request to the general public, When you get fever, please come to the health center and get checked for malaria and dengue. We have the kits, we do it, the antigen kit. And if at all you have done the test and positive, make sure as soon as you get the report to inform your health wellness center in your village or any one of us here at the primary health center. The patient did not come. Just give us the details so that our staff can come and do the anti-container drive and the fogging that is required to be done to mitigate the spread of dengue. So if we get information earliest, as soon as the report is positive, we will be able to prevent the spread of dengue and we will limit ourselves to that patient only. So far we are able to prevent the spread even to family members in our jurisdiction by the immediate action taken by my sanitary inspector along with the staff under him for dengue cases. And we hope that with the cooperation of the public, we will continue and be able to continue to maintain the status of prevention of dengue cases even to family members if reported at the earliest.